Hi, everyone. Welcome back. Today, I am talking with Dr. Jessica Daigle. Jessica is a board-certified pediatric hospitalist with a focus in neonatal medicine. She graduated from Xavier University of Louisiana with a Bachelor's of Science in Chemistry, received her Doctor of Medicine at Louisiana State University, completed her pediatrics residency at Morehouse School of Medicine, and received extra training in neonatal perinatal medicine at the University of Maryland Medical Center. She now proudly serves as a neonatal hospitalist at the medical director of the Level 2 NICU Wellstar Spalding Regional Hospital in Griffin, Georgia. Her passions are communication with families in the nursery and NICU, improving patient experiences by understanding and resolving implicit bias in healthcare, and her kids. I am so thrilled that she is here with me today, and I'm so excited to talk with her. Hi, Jessica.
Hi, thank you. Thank you so much for having me. I think this is such an awesome podcast and vehicle you have here.
Thank you. Thank you. I really appreciate that. So our topic is joy. So I am so curious to know how you define joy. Do you feel like it's a thought, a feeling, an action, all three, something else?
I think it has to do with like your perspective about how you live your life. And it's a feeling too. Like I define joy as having happiness and gratitude mixed together. So I remember when growing up, I remember one of my youth pastors saying, don't focus on having happiness, focus on being filled with joy, because happiness is based on your circumstances, like what's happening at that moment. So something may be happening that doesn't make you happy, but you can still have joy because you understand something about that situation. You have an outlook that something's going to be better, or you're grateful for whatever it is that you're going through, knowing that it makes you better, like you're going to grow from it and through it. And so that's why I think that joy is more about how you feel and also the perspective and action you take towards living a life of gratitude.
Yeah, I love what you said there. It sounds like you're saying it's coming from the inside. It's not an outside, because you're saying it's not a circumstantial thing. I think that is so key. I mean, I think you hit the nail on the head there.
Yes, it is. It really is. Because I mean, at any given moment, something can happen all the time that can make you unhappy, right? You can be displeased, but that you can separate that from having a joyful feeling,
Yes, yes, exactly. And because it comes from the inside and it's not dependent on the outside, it really doesn't matter what's happening externally.
Yes,
it's an internal experience.
That's right.
Yeah.
That's right. That's what I believe.
I love that. And even joyful kids all around. That's great.
That's right. That's right. You got to take that moment too. Yes, indeed.
Good stuff. So what brings you joy? When do you feel the most joy?
Oh, I feel the most joy with my kids. It's so funny just watching them explore their world and what it means to them, and the moments of happiness that they experience. Like my daughter we were just watching like this little Barbie movie, and they sing, and so she's like, "Mom," and she's like, I love that. That brings me joy, because you know what, she is feeling what's happening around her. She's experiencing her moment and living her truth in it. Like she doesn't care that she's dancing and whatever it looks like. She's doing her,
Yes.
Okay. Liam, get those toys down. Thank you.
I love that. No, I love that, because it's so true. Kids don't have that filter that we sometimes have as adults. Like we worry about how we're being seen or what people are going to think and all that. And they're like, no, I just feel like doing this.
They actually get that from us, when we're like, it's funny because, you'll be with your kids in a restaurant and they'll be loud and you'll be like, shh, shh.
Yeah.
But they don't really care. And it's funny, like you'll get two reactions. You'll get the people who are probably like, yes, please shush your child. And then then you get the other people that are like, oh, it's fine.
Right.
And so they understand. And so it's just funny how that perspective, like from those other people, like what's going on in their mind and in their life, or if they have kids, and that shared experience makes them respond differently, right?
Right.
So because they've either been there or they are there in any given moment.
Exactly.
So working with the families in those difficult, helping people through, whether it's a great experience in terms of the baby comes out, everything looks great, and they're they go home like they expected to, or whenever they have to be admitted to the NICU, like that. I enjoy all those experiences of helping families.
Yes.
So,
yes.
Every time I'm on here, she just wants all my attention.
Yes, of course. That's natural. That's the way it is.
So those are I think are the experiences that bring me joy. Seeing other people enjoying themselves brings me joy. Just like it's just because this world is filled with so much, like heartache at times.
Yes.
So just seeing other people enjoying their experiences or their lives or whatever, I love that. Like just seeing good positivity, that brings me joy too.
Yes. And it's so awesome that you're at the beginning of life, with the babies and in the NICU. I mean, they come in just so full of, I know they don't speak at the beginning, but they come in so full of joy. I mean, you could just feel it and see it.
Yeah, you can. Yeah, they're just wanting to take in everything around them. And I tell the parents, you can see a lot of personality in a lot of those babies too, right away, And so we'll sometimes laugh about that, like what we expect, or who's he acting like, mom or dad, and and things like that. And so it's fun to have fun with families like that too, like little behaviors that they already have just that early.
Right.
Like that whole nature and nurture, I do think is a mix for sure.
Yes. Oh, totally. Yeah, no, that's a great point. Yeah. Babies and animals are just in that space of just pure joy.
Yeah. And so it speaks to how your environment does shape you. It really does.
Yeah. And that's awesome. You get to experience that so much in your life and your work.
Yeah, I love it. Yes. Like that's why I would not ever want to not do it. I maybe scale back or, just because you want to do other things in life, but I will always want to be doing that, until my end, I would imagine, even if it's just like PRN, like a weekend here or there, I will always, because there's no place like, the nursery and the NICU and seeing those babies, like at the beginning.
Yes, exactly.
Because even at the pediatrician office is still like a little bit of ways out sometimes. And so I like being there, like right when they're first introduced to them and things like that. That's so fun.
Yeah, it sounds like it. You have a cool job.
Yeah, I do. Oh goodness.
Oh, that's great. Okay. Well, how about a story maybe about a time with your family or, when you're on vacation that just had a lot of fun?
Yeah, so recently we went to Clearwater Beach. It's a really nice area there. And it's funny because I had posted a post of myself pregnant with my daughter Avery's too. That was the last time we were there in like 2018, because then, just kind of work and then COVID and everything. So I posted like the last time we were here, she was inside of me and now she's outside of me. And so those two experiences, and we ate at the same restaurant, but just kind of taking that all in. And so I was just so excited to bring them back there.
Mhm.
In that experience. And so just watching them run around in the sand, and
Mhm.
she loves water, and I'm, putting her in a swim program now, but she just thinks she can swim. She knows this. Like when I'm trying to keep her from going all deep into the water, she's like knocking my hand away, telling me to let her go. And I'm like, okay.
Okay.
Trying to take a fast exit here, lady.
How old is she?
She's 2.
Okay.
Oh,
Two going on 15
3.
probably.
Yeah, 2 going on like 30, because she'll tell me, no, I don't want that. And then I'm like, I told my mom the other day, the boldness that must exist inside of a person
Yeah.
that young to tell you what they do not want.
Right.
And they're
Right.
sure about it, and they don't really care about your perspective. I was like, we as adults, we don't have that freedom.
Right.
People do. It does matter what we say and do.
Yep.
And all of that. So, it was just fun to watch them interact with each other, her and my son, and chase each other around and things like that. Because I'm an only child, so I didn't have that experience with like a sibling. Like my cousins and I would go and do things, but it's just so fun to watch them interact and have that bond, and go between that, get off of me, to like they're loving each other, and it's the best thing in the world. Yeah. So that brought me joy. And then my husband, he's real laid back, but he even let them bury him and stuff like that in the sand and things.
Awesome.
So just experiencing like the fresh air and just not having to care in the world beyond, enjoying each other and getting some good food, because I love to eat. That brings me joy too. Let me mention how food brings me joy.
Absolutely. Oh, I'm so right there with you.
Like when I wake up in the morning and I'm grateful for my life, I'm like, what is it good that I can eat today? My husband said that that's the only reason I work and beyond the bills is so I can buy something to eat somewhere. I'm like, pretty much. Yeah.
Oh, I can so relate to that one.
I tell him all the time, well, the Bible said you don't work, you don't eat. So I work, so I eat.
Hey, there's nothing wrong with that. We have a body, right? We're supposed to enjoy feeding it.
That's right. That is right. So so that's my most recent moment. That's my most recent like family moment. But just every day with them, I find something that entertains me, with them. And so I find myself laughing, or just, like yesterday I was feeling so like, and then I just sat in the bed with my daughter and we watched the little movie, and she kisses me on my cheek. And, these are just good moments. I just love those moments.
Yes.
And, yeah. So it's just really being able to bask in the little things, It's I think you practice having joy too.
Yes.
It's a practice. And like they say, you do it until it's natural or habit, whatever.
Yes, totally. No, I agree with you 100%. It's a vibration that you just kind of get used to, and you go there, and you get there by what you said, appreciating the little things. I mean, those little special moments that you just mentioned, like with your daughter, just that lying in bed watching that, it's just precious.
Yeah, it was like just, I'm off. I'm like, okay, no one has to call me about anything. I'm just like, me, it's just her and I just doing our thing.
That's right. Nothing else happening in the world, just what's happening right here.
Yes, right here. Because if you look for it, there will always be something, there's a problem for sure, and so I've been working on that too. And it's so important. One of my friends said this, and I have been sharing this since, and she said that the greatest gift that you can give your kids is mental well-being. And that has stuck with me, because it's made me think about my actions and my perspective, the things that I say around my kids.
Yes.
Like when my son has a problem, my husband says, we don't cry or complain, we fix the problem. And sometimes I'm like, well, I might want to cry about it, but but I get his point. Like, don't stay stuck, look for a solution,
Yes.
And so that's important, because they're going to grow up and have their own experiences, and you want them to have that foundation for how to still be joyful and appreciate their lives just despite the circumstances, So I really have been focusing more on that the last couple of years as I've had kids. I don't really think was ever really a particularly negative person, but I've just started to pay attention to it more now that I have kids. You know, they definitely bring things to light for sure. Make you reflect yourself. Like, are the things they're doing a reflection of me? Am I doing something that's making them think that that's okay or not okay or whatever? So
because they are learning from their surroundings and learning from their role models.
Sometimes they learn so fast. Like my daughter, like, why does she know to do that? Like, and some stuff I'm like, I don't know where she gets that from. And then I blame it on the nature at that point.
Okay, that's right. No control over it.
Yeah.
When in doubt, blame it on the nature.
Yeah. When in doubt, blame nature, or it's my husband. Like,
there you go.
Everything that's positive, I'm like, well, yes, that's me. If she does something crazy, I'm like, I think that's you, honey.
That's perfect. I love it. But I think your husband had a good point. I hear what you're saying. I mean, maybe he's just like, don't stay stuck there. Like you're saying, if something goes wrong, you know, you don't have to stay in a negative place. You can move on to positive.
Yeah, and it's interesting. It's like every little thing. Like I think he was trying to get something out the pantry this morning. We were in the dark because it was like real early in the morning. We got up like 6 o'clock to take my aunt back to the to the airport or whatever, and so she was leaving, and he was looking for something he didn't have the light on. I was like, well, Liam, what do you need? Light. So you go and you cut on the kitchen light. I mean, and it's so interesting. It's funny because you feel like, why would I have to say that? But you know, like sometimes it's just you gotta help them out.
Got to.
So that was the solution. You can't see, you need light.
Right.
You can make this happen for yourself.
You have the power. You have the tools.
Yes. And I've been working on that too, because you know he's my first, so I think he is a little bit more spoiled, but I have been trying to rectify that now. Like, you're capable of running your water, you're capable of, you know, getting your clothes out that you want to wear.
Right.
You know, he's very sharp. So I know it's just that old mommy used to do. Well, we need to get you prepared to do things on your own.
Right. But it's easier. Just mom does it.
It is. And sometimes it's easier for us parents if we tell the truth. So sometimes rather than harassing them, let me just go ahead and throw these clothes on the bed, put that on and get on, you know, and you move on. You don't have time to be arguing with them about which shirt to wear, you know, stuff like that.
And how old is your son?
I go back to, he just turned 8 on Sunday.
8, okay.
That's what I go to because I said so. You know, that's the number one parent right. That's a rite of passage to say that.
That's right.
Yep, you earn it. When you haven't become a parent, you earn the right to say that phrase.
That's right. Oh, that's great. I love it.
Yeah.
Oh, wow. So could you tell us about a time in your life that brought you so much pleasure that you wish you could repeat it?
Oh, well, let's see. I have so many, but I really, now that I'm repeating it, like I really was really excited when I graduated from med school. Like that was just so huge. Now I wouldn't want to have to go through med school again.
Right.
But if I could go back to the day of the whole experience, the stage, that was a good one. Actually having my children like right when they were born, you know, like right after all the pain part, and they came out. Because I wanted to, you know, it's like really take in the moment because you know, like you're just then push them out and you're like, oh, okay. And then, but like to be able to be like, wow, like what was I thinking in that moment, or be able to know what I was thinking in that moment, how I was feeling. I wouldn't mind like just basking back in that whole experience of them coming into the world. Because I watch it so much, then I felt like when I went through it, I was just kind of like checking off a list because since I do it for a living, like, all right, I gotta do this, gotta do that.
Right.
You're gonna have to go here. They need to get this done. And I was kind of still like in a work mode, so to speak. Actually, with my daughter, when I pushed her out, I actually pulled her up from out of me and put her on my chest myself and suctioned her out. And the residents were over there looking like, and then the attending was like, she's a doctor.
She's a doctor, right?
Well, they were like, well, she's a pediatrician. They were like, oh, okay, we get it.
That's awesome.
Yeah, so I do remember doing that. But those are like I think the biggest things, just where I like completed like a phase,
Mhm.
like reached destinations of things in my life. Those things definitely have brought me joy,
Yeah,
Mhm.
those are big ones, big
Yeah,
milestones, huh?
yeah, because I was like the first one in my immediate family, and probably even like my extended family, I think, actually to
Mhm.
be a doctor. I think I have like a second or third or fourth cousin or something like that. That might be an older cousin, like one of my dad's cousins, but like just in our immediate family, I was the first one to become a doctor. So that was like really huge and everything.
Oh, that's awesome.
Yeah,
So
yeah.
that you could experience it and you shared it with all your family, I'm sure they're
Yeah,
right there with
yeah, that
you.
was cool. Yep.
That's good. That's a good one. Good
Yeah,
stuff.
yes, it was. It was fun.
Oh, that's great. I really like that image of you being the first one to pull your daughter out and just
Oh
put her on
yeah.
your chest.
Yes. As soon as she popped out, I was like, all right. I was like, do a little delayed cord clamping and
That's
oh,
great.
and I was like, okay, well, you guys can take her and weigh her because I'm curious.
Right, right. You got to do your thing, but
I always do get that question from the parents, like, well, we haven't weighed them yet. They've still been on your chest. It's so funny how they think we would just know right away.
right,
They're so cute. They're just in it, they're just in the moment too.
right, right,
So,
right.
yeah,
Yeah,
so that's
that's so
good.
special. Oh my
It
gosh.
is. It is. I mean, when you think about all that it takes for a human being down to your cell, I mean, I think
Yep,
it's the most miraculous thing. Like,
totally.
and even when I have babies that something didn't go as planned or whatever, like I still am amazed at all the other things that still went right. Like,
Mhm.
say they just couldn't breathe because they were born a little bit early. Well, as far as we know, if they have all their organs and
Right?
their toes and eyes, and I mean, I think where everything is in the right place, and
Yes,
I mean, that's
yes,
just so fascinating. That's
it
so
is.
fascinating.
Yeah. I think we kind of get used to it. We kind of take it for granted, but
Yeah,
if we stop and really think about it, it is truly a miracle.
yeah, yeah, it is. And I try not to. And again, that's still a practice. Like you have to be intentional
Mhm.
every day with like your thoughts and the things that you do, like what you choose to think about.
Yes.
You are in control of. And I think for a long time, I didn't think that. I think I just thought I had to think whatever was in my head.
Mhm,
Like, well, that's what
mhm.
I'm thinking on, like, well, change your thoughts then. Say, you know what? Yes, I thought this and I don't believe that, or I
Right.
don't want to be like that. So then what am I going to do to be different, And so we do have the power for sure.
Oh, I love that. That is so right on. I'm so glad you mentioned that because our thoughts really create our reality. And if we don't like them, we can change it. We can change
Yes.
our thoughts.
Yeah, you can. I mean, it really is. Like if you think you can't do something, you're not going to try. You've
Right.
already just stopped yourself. Like,
Yep.
you're like, well, what's the point, right? That's what you're
Right.
telling yourself. But if you're like, you know what? I'm gonna go and see, and then I'm gonna see what happens, and
Right.
then you might be surprised either. That's why I believe in asking whatever you want, like
Yep.
people for stuff, because I'm like the worst they could say is no, and then you're
Mhm.
still back where you are anyway.
Yep.
Like it didn't change,
Exactly.
or or they could be like, wow, I didn't think of that, or
Mhm.
hey, let's try it, and then now you have a new reality, and maybe you've sparked something in someone else,
Yes.
and then it could be like a chain reaction.
Yes, exactly. And I
Yeah.
think that's so awesome because we can't your image of a chain reaction, we can't see step 2, 3, 4, 5 sometimes.
Yeah,
Even a no could lead you in another direction. We just don't
that's
know.
true.
I mean,
Yes, that's true. Yeah. Or it might be like not right now. Sometimes
yeah.
it's not necessarily no
Hmm.
all the time. It may be like, well, right now I'm trying to do this, but
Right.
definitely next month I might be able to do X, Y, and Z. And you're like, oh, okay, well, I could give it a month or
Yep.
whatever it is.
Yeah.
So
Yep.
yeah. Mm-hmm.
Yep. You never know. You never know. You stay in that place of being open and just
Yeah, yeah. I
whatever.
think I think that comes from believing in yourself enough too,
Yes.
and trusting that whatever's inside of you is there for purpose too.
Yeah.
And connecting to another person and another person, all of that has purpose, I think.
Yes.
Yeah.
Yes. Yes. Oh,
Mhm.
that's beautifully said. Yes. I
Yeah.
love that. Awesome. Okay. Well, how about a time when you were feeling down and then something happened that maybe lifted you up? whether it was a change in mindset, thought, event.
Yeah,
Something.
yeah. So I will tell a story that I talk about with my patients in the NICU because of working in there, like I see loss too. And so
Yes.
excuse me, before I had Liam, I actually was pregnant before him,
Mm-hmm.
and I lost that baby, miscarried at 20 weeks, and I named him Isaiah. And so I kind of went into just like a little early labor. And so when I got pregnant with Liam, I saw a maternal fetal medicine specialist, and that's a doctor that takes care of high risk pregnant patients.
Mm-hmm.
And so, they put me on a medication to I guess, make my uterus and cervix and stuff more sturdy is the way I would describe it, especially for listeners. but whenever it was time for the reveal of his gender or sex, and I was like, oh goodness, this is around that same time, because you think back, you only know what you've either but been exposed to or experienced before, right? That's
Right.
all we compare ourselves to all the time. And so my son was doing like this little flex pose like this inside the womb. And my husband was like, he's trying to tell us he is strong and he is going to make it.
Awesome.
And so that's why I named him Liam, because I was like, well, let me look up boy names that mean like strong or warrior. And that name means that. And so, and I always show him that picture of himself too. And he was born at 31 weeks. So he still was early, but it was still enough where he could make it. And he actually did great in the NICU. He was only there 4 weeks, more slow just to be what we call like a feeder grower, because, they're not really quite ready to eat by mouth yet and things like that. So they still have to grow outside of us. Like I tell the parents, they're still in that same fragile state. They're just needing to grow to be closer to the time when they would have normally been ready to come out,
Right.
Or when they would have been, when I say ready, more like everything more developed, to function on its own at least. And so, so that was like a trying time. But even then, now that experience helps so many of my patients, because they know when I'm telling them about what to expect in the NICU with their preterm infant and what, we hope to see and things like that. They know I'm also not just speaking from a professional experience, but a personal. And I think it gives more weight to it and encouragement, because sometimes I think our patients think just because we're doctors, we don't have real life experiences either. Like,
right.
And it's like, no, we struggle like everybody else.
Yes.
We have doubts and we have problems and health challenges and everything else. And I think that's the shared humanity that people forget to tap into. And that's what can actually help other people feel like they can survive their own experiences when they see somebody else has done the same. So that would be what was probably a hard time for sure, but I've been able to turn it into a positive experience to help others.
Oh, that's awesome. Yes.
Yeah.
We never know where our experiences are, how they're going to benefit or what's going to happen. That's
and definitely at the time you're just kind of like, and then I learned from that loss, like people I was close to, like a lot of some things are so taboo, right? People don't want to talk about things, which I understand for different reasons. Some of it's cultural, some of it's very, very painful for people to talk about. And they're still dealing with the grief or the belief that, of that situation. But a lot of people that after that happened to me, people I'm close to told me that it had happened to them. And then my mind was like, wow, and it would be people who may have had a couple losses and now have 4 kids or, different things, but it was a lot more people that I realized that went through. Like I knew the numbers statistically as a doctor, but then like personally, again, like I knew the numbers, but still experiencing it or hearing it from people I'm close to, like this lady who I used to babysit for, or, my sister-in-law's mom, just for people who came to encourage me during my time, I was like, oh, well, and that can encourage me even then.
Yes.
Yeah. Sorry.
It's okay. That feeling of support was there. That's just an amazing feeling.
It really did. It really does make a difference because, your circumstance is what it is. And I tell that to my patients too, like, okay, yes, we're now faced with this baby that is doing X, Y, and Z. And no, you didn't expect that. For a lot of the parents, they didn't know, like,
Yeah.
you're going through your pregnancy and, I think ignorance is bliss, because if you kind of knew all the stuff that could potentially happen to your
Yes.
baby, people probably would not have kids. They'd be like, oh no, this could happen. They could be born with this, So
Right.
it was
Right.
good to not know some things,
Yes.
But then when it happens, I always try to, I'm definitely sympathetic to the moment, but I don't ever want them to stay stuck in a state of depression. I'm very careful, and I pay attention to that in my families, and I try to do what I can to help to give them the hope that's appropriate in terms of, okay, based off of this, what we see right now, what I know is possible. I try to paint that picture for them so they're not just focused on the problem, but where we can get to. Because in pediatrics, for the most part, unless there's a particular genetic things that, have hard answers a lot of times, most things in kids can get better with time and treatment and things like that, which why I love pediatrics. Kids are so resilient.
Yes.
And so I try to help move them out of a place of feeling stuck and say, yes, your baby was born and he needs a little bit of oxygen, but hey, he's term, so that's a win for him.
Yep.
He's not needing as much. Like I tell them what could be possible in terms of like when they're looking really worse. So hey, he's on the lower end. So I really try to let them say like, hey, we are here, but we can get to a better place. And I think that's important for all of us to be able to see better in circumstances.
Yes, good point. Yeah, no, that is the perspective thing that really helps out.
Yeah, it does. It really does. Like if you had to choose which way to think, because let's think towards better, because it improves your mood and it improves your action too.
Yes, absolutely. Well said. I love that. So how about a time when you erupted into spontaneous laughter, like it just came up and out of you?
Oh, most of the time that happens is when I think of something my children say.
Okay.
Like one day I was driving home. Oh, so I work 2 weeks on and off in the NICU. And so one day I picked my son up for school. Again, they're paying attention, they're listening. I was like, man, I'm so tired. My son was like, well, that's because the nurses call you all night saying blah, 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 blah. And I was like, yeah. And he was like, you could just get another job, right? And I was like, what? I was like, yeah. I said, yeah, but I do like the work that I do. It's just because it's a lot, it's every day for a certain period of time. Right. And he was like, and then you can get another job and then just text everybody at your old one so they don't look for you. And I was like, what? Like,
it's so simple, Mom. Come on.
And this is word for word how he said it. And then he was like, I always have a plan. I said,
Mommy. That is awesome.
Yeah. So it's stories like that I'll just like be driving down the road and I will just like start laughing because I'll think about that conversation, or just, I have a number of them. I post them all the time because they are quite hilarious. Because he is so very serious when he's talking about stuff.
He says these things with a straight face. Huh?
Yeah, and then because I'm driving, he's really often just like talking, like he's not trying to be funny. This is really what he's thinking, And so when I told the nurses at work, they was like, "That's definitely your child," because I always have a plan too. Like when I'm taking care of my patients and I come and I run the plan by the nurses. I'm like, all right, this is what we're gonna do. So one of the nurses was like, yep, that's your child because you always have a plan too. Yep.
So that's the nurture part coming in, huh? We talked about nature versus nurture. This is
that's
nurture.
True. He seems to be planning. I love to kind of outline some things. Even when I wake up in the morning, okay, what do I need to get done today? Which order do I need to do this in? That's how I am. Sometimes I wing it. I do believe it's good to be spontaneous too.
Yeah.
But for the most part, I do like to have some idea of what it is that I'm getting done.
Yes, absolutely. 100%.
But that's when I erupt into laughter, like spontaneously, is I thought of something they have said or done.
Okay.
because they're always like in my mind too. Like I'm
Yeah.
always thinking about them too, and
Mhm.
and everything, like outside of just other things I have to get done and stuff like that. So yeah.
Right, right. Yeah. Oh, that's great.
Yep. Hmm.
I love that. So they really keep you in that fun, happy, laughing
Yes,
place.
yes, and yes, my daughter, yes, her right here, right now, trying to hit me up inside my head with the brush to clean my son's water bottle. Yep.
It's important. It has to be done right this minute.
She's like an all eyes on me kind of a person.
Mm. Oh, that's great. That's
I'm so excited to see what both of them become,
yes.
That's one of my prayers. I'm always like, Lord, let me live long enough to see my children become like adults and
Yes.
just what do they get into and stuff. Because I just would like to be able to, I would like to be able to reflect on that, like think
Yeah.
back to moments of their lives where it's, I saw that, like that interest or that, thing peak up or whatever. So like
Right.
she likes to dance. And so it's just interesting. It makes me curious, like, will she become a dancer or
Right.
will she go into art? Or it's just wonderful to think about.
Absolutely. All possibilities are available.
Yeah. Yep.
Mhm. So what puts you in the flow state when you feel like things are easy and you feel productive?
I think for me it's really getting up and spending some time in my devotional and some in prayer
Mhm.
and just some quiet time. Being really intentional about that. I feel like okay. Music, I love music. Okay, like that's my thing too. Like
Okay.
I'll just play it and just sing it. I'm that person like when you're driving next to them, they're like, that's me. Oh, that's me. That is me all the time. And I'm probably like, people are probably like, what's she doing? Or she having a good time by herself. But I think you have to be able to,
Yes. Absolutely. Absolutely. It's back to that first thing when we started our conversation about how it comes from the inside. You're not
Yes.
relying on the outside. You're just
Yes.
happy.
My son asked me that one time. He's like, you're like always happy or something every day. I said, well, I'm not always happy, but I am happy every day. I will tell you that. I said, like, there will definitely be things in the day that makes me unhappy,
Mhm.
but I definitely find opportunity to laugh at something or share a funny story.
Mhm.
And so I enjoy the people that I work with too, so we'll kind of cut up with each other about different things, and
Yes.
it's just again like if there's a moment I seize it, and a lot of times we end up cracking up about things with our kids and stuff like that, because everybody have like kid stories, especially if you have kids.
Right.
It's funny because I remember before I had kids I used to kind of be like, why do people always want to talk about their kids? Then I had kids and I'm like, I'm that person now. Yep, that's me. I'm sorry for all the people I judged out there. No, I'm just kidding. Take it back. They're all your pictures all the time. No.
Oh, that's great. Oh, wow. That's
Yeah, so
awesome.
those are the things that bring me joy. Okay, go get it. Go get it, love. You need help. All right. Yes, indeed.
Oh, so how has feeling good helped you be more successful?
I think that again, it goes to that perspective um, of like, okay, this is happening, that's frustrating me, but here's the good side of it. Okay, Avery, hold on. This is the good side of it, and so I've committed myself to doing one thing a day that like brings me joy. Like, and I know we've already said it's kind of on the inside, but just like guess I should say adds to my joy.
There you go.
So like, like if I want to stop and get some ice cream, I'm gonna do it.
Mhm.
If I want to listen to a song real loud and obnoxiously, I'm gonna do that too while I'm driving. If like I love doing things with my kids, so let's go to the park, let's take a walk outside, just things like that. I just try to do at least one thing that kind of makes me feel good.
Yeah.
And then keeps adding to that, you know?
Yes.
And so it's really, because sometimes I've decided that I'm going to extend myself a little bit of grace every day. Because we have so much to do. Like I have so much to do, and it's so easy to get overwhelmed. And I'm trying not to live in a place of overwhelm. So I've just decided that I'd like to make lists. So I'll write it down and say, okay, well, what can I do today? And then what is okay to like do tomorrow? Like someone sent me like a little chart. And it's really cool. It's like this 4 cubes thing. And it's kind of like triaging the things like need to be done like right now or need to be done then, you know, some near distant future. And like, it's basically like that. So you can kind of help yourself not to feel bad about the things that you don't get done all the time, because well, it's not really something that needs to be done every day anyway. You just may need to do it. Like say paying your bills. Okay, well, maybe one day of the month you dedicate to, all right, I'm getting all the bills taken care of today, whatever. So it's not like, oh, I forgot like that was due last week. And, you know, I had to do that for myself because I would like forget like, oh my goodness, when I'm on at work, I give myself like, I'm on, you know, outside of anything with my kids, my focus on what I'm doing, because I'm on 24/7. So I could get called at midnight and have to go in and still have to come back at 7 and that same day later and round again, you know, depending on what's going on. So, that's really it. Just trying to like little things that I enjoy. Like I like to read. So sometimes I'll just take 10 to 15 minutes to just read like a fiction book that I like. I'm new to social media this year, like 37 years old, just now on social media. Don't you listeners judge me. But so there's this guy I like to follow called Tremo. He's a comedian, and so he cracks me up. But he has this puppet, and the puppet is Keisha, and so he does like different things like, that's quite entertaining. So like last night I was cracking myself up at that, and one night I watched it from like midnight to like 3 a.m. I was like, this is ridiculous. I need to go to sleep. But that made me so happy. Like all day, I was just cracking up thinking about it. I love comedy. Like when pre-COVID, me and my husband would always go to like different comedian shows, because comedy is often founded in reality. Like, and that's why it's funny, because you either know it's you that have done it or somebody you know.
Totally, right?
And you get it because you either identify with that about yourself. And even if it's something that you need to do better, you're like, well, you know what, they calling me out. I just gotta accept it and make it better.
Totally, yes.
So I love comedy. I think you have to be able to laugh at yourself. You know, because like, you know, you have to just think, where are we really going with all this? Like all the things that we're doing, you know, like in our life. And so I've been really thinking about legacy, like what I want to be remembered for, what I want my kids to remember about me or know. And I think that that's what the purpose of it all is anyway, because when you leave here, you can't take anything with you anyway.
Exactly. No.
So it's really about the legacy that you leave behind, the lives that you touch, you know, and your kids, which is a life you're touching, you know what I mean? So
exactly. Yeah. Totally. Totally makes sense. Do you have any daily practices or routines that you do to help you connect to your joy?
I think I wake up in the morning. Like I said, I like to pray. I definitely pray. I have this devotional. It's like somewhere around here. Well, I'm definitely a woman of faith, and so I bought this one for my son. But they have a women's version. It's called Jesus Calling. Sorry, it's kind of going to be probably backwards for you guys, but it's 365 devotions. So it's just to talk about different things like having a joyful heart or not being afraid, and it'll base it from scripture, but it'll be so practical. And I did it for my son because I want him to be able to take away a lesson for him each day, like of what he should strive to be like in terms of like his character and things like that. And so I do the same thing. There's like an adult version. So I'll just read that and then I'll just meditate on whatever that is, like, you know, having a joyful heart. Okay. So then I'll go through that day, and if a circumstance comes, I'll remember the thing that I meditated on, you know. And I think that for people, even if it's not that, but they're doing positive affirmations, I think it's important to wake up every day and tell yourself things like, Like one of my favorite ones is this guy. He's a his name is Mike Howard. He's a public speaker. He's here out of Atlanta, actually. And so one of the things he likes to say is sometimes we win and sometimes we learn. Like he doesn't like to say we lose, because he's like, you don't think it's losing, it's learning from the experience.
Yes.
You know, so if it, you know, so it's about, again, your perspective, you know. And then he was like, another one he says is a bad attitude is like a flat tire. You're not going anywhere if you don't change it.
Oh, that's great. I love
like,
that.
That's so true, because you're not going anywhere if you don't change your flat tire. I was like, that's brilliant.
Totally. I love that.
Yeah. And then he's like, you know, growth is doing the uncomfortable until it becomes comfortable. And so again, speaking to that thing of habit. So I think sometimes we get caught up in what's natural to us. And definitely some people are more natural at things and some people have to work at things, but it doesn't mean that it's not necessary to do or be done. Right. Kind of like when I was in school, there are some people that like the stuff just came to them, like how they just knew that.
Right.
You know?
Right.
It's really that their mind just, I mean, they still had to learn it just like us. Like they weren't born knowing, I don't know, where the heart was. You still have to learn that. Right. But their processing is faster, however their mind works, and, you know, acclimating and assimilating information. Some people are just, they're lightning fast with that stuff, you know?
Exactly.
But it still doesn't mean that they didn't have to still learn the information. So sometimes I think as people, we are afraid to put in the work, you know?
Yeah.
And sometimes it takes work to be, it takes work to be who we want to be, you know. It's just different ways that it happens, you know?
Right.
But so I'm just intentional about introducing positive things into my day. Reflecting on, okay, what is it that I really need to do today? Feeling, because you got to know yourself a little bit more. Like, and I've been spending a lot of time with myself. I think we should do that.
Absolutely.
You know, and even if it's journaling, I've always journaled since I was younger because I like to write. And my mom said she always was like a very deep child. She said some of the stuff I talk about, she'd be like, you're like 7. Why are we talking about this? You know, but you know, I think so. Again, that nature nurture, I think some of it was already inside of me, and it's just developed as I've you know, taken in exposure and experience and built upon that foundation. So I think we all start off with a foundation. Yes. And then we decide what we build on that. You know?
Yes, absolutely. Well said.
And so that's really it. It's not that it's perfect. Like I don't know how personal I could get on here, but you know, women, I think people know women have menstrual cycles. So I'm gonna tell you, whenever I'm on mine, I just figured out about myself that I actually have some PMS symptoms. It just became apparent to me because every time I'd be on, I'd be like, oh, I just want to cry. And I feel like, woe is me. And I'd be like, what is going on? And I had never made that connection until last month. And I was like, and then like yesterday, like what today is? No, Wednesday started coming on. And then yesterday I had that same feeling, but I recognized it. See, I knew where it was coming from and I had a plan in action. I was like, I had done some research. I was like, I need to meditate a little bit more, take a little medicine for my pain. That's why I got with my daughter. That makes me happy. So I was like, I need to do something that makes me happy. So I don't feel all that woe is me. And I got through that day better than last time. I was like, oh, I don't want to work anymore. And it was real. Like I was serious. Right. You know, and I was like, I need to quit my job. And these were real thoughts that I had, you know? And so I learned that about myself, you know? So I don't have like this perfect life or anything like that. You know, I have struggles and challenges like the next person. I'm just choosing to find something each day. Yes. You know, again, like we've already discussed, there will be things that will happen because some of it is not in your control anyway. Exactly. You know, as long as there are other people around, there will be challenges. Yes. We're all different, you know. Yeah. But we don't have to let that define us, you know, and we seek the help we need, you know, and however that is. And so I reached out to one of my friends who's an OB just to talk to her about it, just to make sure I'm thinking the right things and, you know, and just paying attention to myself, you know.
There you go. That's taking care of yourself is key.
Yes. And speaking of that, Alice, September is actually National Self-Care Awareness Month. All you
Awesome.
listeners out there, do something to take care of yourself today, even if it's like
Absolutely.
a hot shower with a candle and some music going.
I love that. Yes, very easy, right? Very
Yep, see?
simple.
Yep,
Doesn't
looks
matter.
like in there in the dark with the hot water running and some good scents. I
There
tell
you
you, do
go.
your mood wonders.
It does. I am 100% in agreement with that one.
Yeah. Or even taking a walk outside or
Yes.
eat a favorite snack that you like, you know?
Yes. Yes. It
Sometimes
doesn't
it's
have to
really,
be
it doesn't have to be
complex.
this big
No,
act. Yeah, it doesn't.
little bit, little
It
things.
doesn't. Yep. It
Those
builds
are
up.
all good suggestions. So, because that leads into my next question, I was going to ask you if you have any tips to help others find their joy, and I think you just gave a couple there.
Yeah, I think some of the questions that you asked today are some things that listeners think of, like what are when define the happiest moment for themselves,
Mhm.
and tapping into that. And it really takes sometimes sitting through it. I've only just over the last year started to learn a lot about myself, even with what about my work makes me happy,
Mhm.
because I was like, well, I always wanted to be a baby doctor, so because I enjoy the population. But what really brings me joy is seeing my parents feeling reassured and
Mhm.
educated and understood and seen, which is
Yes.
what I think all of us want to feel at the end of the day,
Mhm.
And
Yes.
so that's when I've come away from a conversation with them where they are like, okay, like I feel better now that I've talked to you. That makes me feel better.
Yes.
Actually, after anything could have happened. I mean, I could have saved the day. I could have intubated the baby perfectly. I could have
Right.
gotten it IV access in perfectly and did all the medical stuff right. But it's that social piece
Yes.
that really brings me joy, because that again, that humanity, that shared humanity, that
Mhm.
we all really want the same thing at the base of us, to feel loved and secure and healthy
Yes.
and whole.
Mhm. Mhm.
I think we're all striving for that in some fashion.
Yes. Well said. 100%. That's awesome. All good stuff, Jessica. I love talking to
I
you.
love talking to you.
This has been so much fun.
Yes, it has been. Thank you.
And I
Even with
can,
little Avery here in the background cutting up.
oh yeah, no worries. That's part of the joy, right?
Yes, that's right. I got these cool little magnetic towels for them. So
Oh,
if you have any parents that are watching, these are like these little magnetic towels, and you can do all kinds of things with those. And so that's been really fun for the kids. They've been spending hours doing that. Not so fun for my son when he builds his masterpiece and my daughter comes and knocks it down. I don't think that adds to his joy, but
all part of the game, right?
yeah. Oh, he's like, Mom, I don't want to hear nothing about joy right now. Okay.
That's great. Oh my gosh. Well, you have a very busy household there, and I don't want to
Yeah.
keep too long. So where can people find you if they want to reach out to you?
Okay. So I'm just, like I said, I'm just getting into this social media business. So I have an Instagram that's mom and me _MD. So MOMANDME _MD. And it's also linked to a Facebook of the same name. And then I have my own other Facebook page, Jess Daigle, as well, that I often post things through. But if they keep up with me on the mom and me _MD, there'll be more things to come, especially for a business that I plan to launch to help moms after they have had their babies transition at home successfully.
Oh, that's awesome. I know that's much needed.
Yes, I'm so excited about it. Lactation support, emotional support, screening for
Yes.
postpartum depression, helping them get resources they need, even to
Mhm.
take care of chores. It's so multifaceted. Like, when you have a baby, our culture kind of expects people to snap back.
Yes.
And a lot of other cultures, that the mom is still treated as if they're still pregnant.
Yes.
Like
Yes.
on that pedestal, and so we really need to change the narrative for our families over here and let them know that you still need that time, for yourself to heal. That self-care.
Yes. Yes.
It's so important because, again, like I said, my friend said, the best thing that you can give your kids is mental well-being. And so
Yes,
you can't give from an empty cup.
exactly. Well said. Yes.
Yeah. Yes. So thank you so much for having me.
Oh,
I've enjoyed talking with you. I love just
thank
talking about
you.
these kinds of things because I think it's the core of us,
Yes.
and I think the more people talk about it and even think about it for themselves, it can lead to improvement in their own lives.
Yes,
Yeah.
absolutely. Well, thank you for being here. I have
Yeah.
loved talking with you.
You too. And I hope you have a great holiday and you
You
and your listeners.
too.
Okay.
Thank you. Mwah.
Bye.
Bye.